and then we'll be good to go. Good morning, Sharon.
Good morning, Christy. Good to
How
see
are
you.
Yeah, good to see you too. You doing all right today?
I am.
Good, good. Well, I'm excited to have you on. I'm interested to learn more about what it is that you do because this is a new topic for me as well. So, when we saw each other out at several different events, I was like, "Oh, I need to have Sharon on and learn all about what it is that she does and how she helps people." So, thank you for being on this morning.
Absolutely. I can't
Yes,
wait to share. I
good.
think a lot of folks will be anxious to learn more.
Good. Good. Well, after we are complete, what I'll do is I'll tag you in the comments, and then that way people can reach out to you directly with any questions that they have, or you'll
Okay.
watch the comments if people have questions there. So tell me
Okay.
first off just a little bit about yourself and how you kind of came to be involved with LifeWave, and then we'll kind of get into what it is that you guys do.
Absolutely. Several years ago, I was in a car accident and I was hurt and went through physical therapy. But as time went on, the pain kept getting worse, and it was about my neck and my shoulder. And then I was starting experiencing migraines. And if anybody has experienced that type of headache, it just really shuts us down and it really makes us sick. And I couldn't work. My health was really digressing, was eating bad, I was gaining weight. I just wasn't really thinking about, my health anymore. And I just thought that I'm always going to be in pain. And that's not the case. So somebody introduced me to LifeWave about 2 years ago because she knew that first and foremost, that she could help me with the pain. And I was really excited because a lot of things, when we're in a lot of pain, we can't do anything. We can't
Yeah.
work, we can't be with our loved ones. The pain pretty much takes over. And we probably have seen the statistics. 6 out of 10 Americans live in chronic pain. And if you're in pain for more than a year, you're that statistic. And so when I was introduced to LifeWave, I was really looking for a more holistic, natural approach to my own personal health because I was beginning to understand not just me, but other people are looking for ways to not rely on medicines, not to rely on Western medicine. I'm not discounting that, but I think as time has gone on, we are really responsible for our own health, and also finding those folks or products that understand that we do want something
Yeah.
that is going to help us heal our body because our bodies want to heal naturally. That's what they were designed for. And so in my own personal story, I'm serious about the migraine. It was gone within a
Wow.
minute. And it took about 3 weeks for this neck pain, and I had a pinched nerve for it to finally go away. And I'm able to do this, and I like to do yoga. I like to walk. I'm not that super athlete, but
Want
I
to be
did
moving.
start to recognize that, I need exercise, I need fresh air. I need to really recognize also that the foods I'm eating is not really good for me, but in conjunction with this product, it has really helped me and a lot of other people come out of pain.
Well, let's talk about that product. So, I know you and I've talked a little bit about it. So, tell me and everybody who's listening, what exactly is stem cell therapy and how does it help people? How does it work?
Okay. Okay. Well, first, let's take a step back. What are stem cells and why are they important to our health? First and foremost, there are stem cells in our all of our organs, inside and outside skin, inside our body, our brain, our heart, ligaments, and muscle. But unfortunately, as we age, stem cells start to disappear. And by the time we're 60, they're just about gone. And so any injury or surgeries or conditions that we have, we really don't have the master cell to help us to heal or recover like we used to when we were in our 20s and 30s. So stem cells are the master cells and they have everything to do with health. Now, as we're aging, um, just like I said, an injury or a condition if the master cell's not there to help us, then we're just going to get worse and worse and worse.
Right.
But with the LifeWave, it's a stem cell activation therapy. It's not an injection. It's not a drug. And by the way, it doesn't interfere with the medicines that you're on. It's not a supplement. It's not a pill. It's a patch. And if you can see
Okay.
that, it's
Yeah.
about the size of a US quarter. And the owner, scientist, and inventor of LifeWave designed this patch to be worn on the acupuncture points in our body, which has been clinically studied to say that if you wear the patch behind your neck or 4 inches below your belly, that the activation is going to begin on your stem cell. Now, if you have a pain point, like I did with my migraine, I literally did put it right here,
Oh, yeah.
or if you have a pain here, your back, the patches help. So what is phototherapy? It's actually working with our own body's light. We have ultraviolet light. We just can't see it unless we wear those special goggles, right? And so this little patch has proprietary crystals inside of it, so that when you place it on your cheek or your shoulder or wherever, your body's light starts to react to this. And
Okay.
so then it's sending messages to your brain. Where should we work on the stem cells in your body? Is it your heart, your cardiovascular system? I know we're going to talk about pain mostly, but one thing I think all of us, as we're aging and our seniors, are worried about is our brain health,
Yeah.
dementia, the cognitive decline. And this is going to help with that as well. So,
So how does it work? So it's reacting to our own bodies and it's regenerating or it's creating new cells. How does it work?
all of the above.
Okay.
So we're reactivating the stem cells that are in our body. So the copper peptide and the collagen that has pretty much gone away is reactivated. So now we are starting to come out of pain because this patch is reducing the inflammation. So that's where we really need to go deeper. Inflammation causes everything.
Right.
But once we can reduce that inflammation, we can reduce the pain. And so again, a lot of folks feel that they can feel this patch right away. It just depends on how bad their pain is. Um, you know, Let me
So,
give you an analogy. If
okay.
anybody's had any physical therapy, when you go and they put the little electrodes on you, that's
Yes.
phototherapy. That's the same concept.
Okay.
But they're injecting maybe some kind of electromagnetic pulse, if you will. But this is a patch that's working with our own body, and that's why it's different for everybody. And it depends on how your body and how long it's going to take for you to find relief. But it's very quick. It
Oh,
really
that's what I was
is.
going to ask you. So is the patch reusable or does it come in a box and you use one and you throw it away and you use the next one? Do you wear more than one at a time? How does that work?
You've got some good questions. Okay. We want to wear this patch during the day for 12 hours. So whenever you get up and whenever you go to sleep. And don't wear the patch at night because, especially in the beginning, when you're getting used to it, our body needs to heal at night to rest. But yes, so you're going to toss it. And there's 30 patches. We call this a sleeve, if you can see
Okay.
that. It's called X39. That's the stem cell patch. So you don't want to skip a day. You don't want to go a couple days. You don't want to do that. You want to wear this patch every day. And we tell folks that for every decade that you're alive, you really should give yourself that amount of time of wearing the patch. If you're 60, you should give it 6 months. If you're 30, we want you to give it at least 90 days.
Got it.
But absolutely. So something else I want to tell you too is that um, if you have, we don't want to forget about our animals. If you've got a pet, a dog or a cat that is in a lot of pain, is going through a lot of, they suffer just like we do, take the used patch, and place it on their collar or their bandana, because there's still about 6 to 8 hours left.
Oh, okay.
And because they're a lot smaller than we are, they're going to feel the benefits as well.
I did
Something to
not know that you can do that.
absolutely, absolutely.
So ideally, someone who is, I mean, like suffering from joint pain or like you mentioned, migraines,
Mhm,
nerve system, like you talked about that.
mhm.
What are some of the other uses? And like, let's say someone's having joint pain in their knee, would they put it on their knee, or is there a, a guide that would come with the patch to tell them how to use it?
Absolutely. Um, if we have a pain point like in our knee, we would place the patch right on the knee. And your other question was, can we wear more than one patch?
Yeah.
Absolutely. If we have somebody who can't even walk, or they're using a cane, or even in a wheelchair, if you can't even get up without your knees hurting, yeah, wear more than one patch. Maybe place one on each side of your knee. So absolutely. The the whole point is to help somebody alleviate that pain as soon
Yeah.
as we possibly can. So, I just forgot about your other question.
Well,
Um,
golly, I don't know that I remember it. Um, but I do have another question. Maybe we'll remember the other one. Um, what would someone expect to pay for something like that? So cost, I think a lot of people will be like, what is it going to cost me?
Absolutely, absolutely. As you know, before we answer that, we do know that a lot of folks out there may have paid for stem cell injections, and those are very costly. Sometimes they work, sometimes they don't. Some people go outside the country. Um, there's no reason to pay thousands and thousands of dollars. This patch for a 90-day, or I'm sorry, a 30-day supply of 30 and wearing it every day, it's $99. And there's a couple different ways, you could become a preferred customer, and set up an auto ship and get it every month. Or there's another value pack, as I call it, where if there's more than one person in the household, or more than you want to try the patch more than 90 days or 6 months, we could, work with you on that. But it's $99.
I mean,
So
that seems pretty reasonable. That's what, $100 for the month,
yes.
because you wear one 12 hours, you don't wear it at night. So you just
Uh-huh.
wear one every single day, or if you
Yes,
had multiple spots, maybe a little more, but okay. Um,
absolutely.
yeah, I mean, that's seems pretty reasonable to me. If you're in pain, to get rid of the pain. I don't know, can people use like their HSA or FSA for something like this? Are you guys considered medical?
It's not a drug. It's not a pharmaceutical. It's not something that the insurance is going to pay for. So this is all self-pay. This
Got
is
it.
all, something that, and mentioning the drug companies, they've been working on this for years, trying to come up with the same concept. But, if they did, they would charge thousands of dollars
Sure
for
they
it,
would.
even if in insurance probably wouldn't pay for it. But no, 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 you wouldn't. You would just be, setting up on your credit card and receiving the patches every day. Oh, I know what I was going to say. See, it's helping with my memory. You you will get a booklet every time you
That
get
was
a
it.
order an amount, and it's going to tell you where to place the patches. And also, as a wellness liaison, I really like to talk to folks and see exactly what's going on and suggest places. There are protocols depending on what you have going on, and it does not matter the disease, the affliction. I can't guarantee anything. I'm not a doctor, and either is the company, but you're going to hear from me. I'm going to make sure that I follow up with you and how you're feeling. And there are, I have a link. And for each product, and we'll talk about the X39 stem cell patch, because there are other patches, but I focus on this one in the beginning. Um, when you go to my link, it's so great. They show up where to place the patches in a video, but I also provide that too.
Yeah.
So
Well, I think there's a lot that can be said for your personal recommendation, having used it yourself for your own migraines, for your own neck pain, pinched nerve. So, there's a lot. Yeah, you're not a doctor. You can't guarantee any kind of results, but you personally have used it. So I love that.
Absolutely.
I have to ask you about your Zoom, the lady entrepreneur. Is that just like, are you just into lots of different on businesses, entrepreneurial type things? Is this really what you do the most is LifeWave?
A great question. I've used the lady entrepreneur for decades, really. Um, but and I'm glad you asked that question too, because once I got started on the patches and started helping people, I was looking for another income stream, and this just made total sense. It's a win-win, helping people, helping others. So, that's why I like the entrepreneur. Anybody who is open and has that same spirit and would like to learn more about the business side of it, totally open to sharing that with them, because I started out working maybe half hour, an hour a day, and now it's my full time. And I really like it, and it allows me to travel, which is what I really like to do. And we can work from anywhere. And
Right.
this product is helping people in 75 countries, so it's
Wow.
amazing. Yeah,
Awesome.
absolutely.
Well, thank you so much for coming on today and sharing. I think it's very interesting, and I love, kind of the wholesome wellness versus pharmaceutical wellness.
Mhm,
So I'm always interested in products that are a natural
mhm.
remedy versus pharmaceutical remedy. So thank you. I appreciate your time.
Oh, I'm so glad that you asked me to come on board, and I hope that it's information that will help some of your folks, and I'll be glad to answer any questions. Thank you again. I've
Yeah,
had
for sure.
fun.
Yay. Well, I will tag you, like I said, and
Okay.
people can ask questions of you if they have any that I didn't think to ask. I'm sure there's stuff I didn't think to ask. So thanks again, Sharon.
All right. We'll talk to you soon. Bye-bye.
Bye. Okay, so let me stop the recording also.